Hey guys, good day. How are you doing today? It's your girl, Miss Debs. I'm coming to you from Deborah's Delicious Dishes Kitchen here in Orange, New Jersey, giving honor to my Lord and Savior Jesus Christ because he's so worthy to be acknowledged and praised on this day and any other day. Guys, today I'm coming to you to give thanks to God and to show you guys how much me and my daughter and my family appreciate the love that was precipitated and all the well wishes that went out and the prayers constantly. People hit me up on social media saying that they're really praying for me and my daughter and my family. And I just want to let you guys know that means the world to me because that is my only daughter. And whether I had 50 daughters, I would feel the same way, but it's a little more significant, or I won't say significant, but it's a little more detailed when you know that's your only daughter. So I want to thank God for allowing me to birth this beautiful woman into the world. I want to thank him for giving her to me on borrowed time because we know our children, they're God. They're God's children, but he allows us the gift of birthing them into the world and for raising them and being their parents. So I want to thank him for that. And I want to thank him especially for not taking my baby to see fit to take her at this point in time in her life and our lives. So Takia, she came through the surgery. She was in the hospital for a week. She came home Friday evening, and she's not quite herself yet. She's walking with the assistance of a walker because being in the bed for a week when you're in the hospital, me being a medical assistant, I know this, and I know some of you know it too, that you lose kind of function in your limbs, like the strength in your limbs to move and the things that you're used to doing or that you take for granted. Sometimes you need assistance with. So that's why she had the walker now, just to build up her muscles and to get her moving around. So she wants me to tell you guys thank you. And she so appreciate all the love and the dedication and the prayers. A lot of you was praying for my baby. Mama T and her family, all my YouTube family, you guys rock. And that really mean the world to me. See, you see where people are when you really go through something in life. And that's what we should all connect together because we are sisters and brothers and we are the children of God. So I'm going to explain to you what was the condition and how did it get to this point. Okay, so upon reading up on it, my daughter was diagnosed with endoscopic endonasal surgery. Well, that's what she had. That's the type of surgery that she had. So I'm going to just let you know what was going on. So through the years, you probably say, well, how did you not know she had this? Or how did she not know she had it? So through the years, my daughter would tell us that she would tell me and her father that she was experiencing headaches. So we chalked it up to the fact that she probably needed glasses. So what had happened was I started taking her to doctors. I was working for I worked for the doctor that she was going to. So she was experiencing headaches through the years, but we thought it was migraine. So as she got older and she started, she had her two girls, she started noticing just recently that nasal fluid was leaking through her nasal cavity. And she was like, Mom, something is not right. She said, I keep getting this metallic taste in my mouth when her nose would drip. So, that's like almost like a metal taste, or like when you take iron pills, that strong, you know, zinc type of taste. So anyway, so she finally went to the hospital and that's what they diagnosed her with. Okay, so let me just explain to you about this surgery. Like I said, it's endoscopic endonasal surgery. And endoscopic endonasal surgery is a minimally invasive technique that allows a surgeon to go through the nose to operate on the areas at the front of the brain. So my daughter had some serious surgery going on. This was no kids glove things. We didn't know the severity of it. So what they do, they go into the nasal cavity and it gives them option by sticking the scope through the nose and doing the surgical procedure that they need to do. It has them to go through the nose to operate on the area of the front of the brain. So she had a crack in her skull. So now I'm on my laptop here, as you can see. So I'm just telling you guys because I think you have a right to know what was going on, because it was just like pray for my daughter. So I'm gonna just give it to you and let you know what was going on. So it says, for routine cases, surgery often takes 2 hours from the time anesthesia is administered. More complex cases may take from 4 to 6 hours. So I have a strong belief in God. God has really been holding me. I'm not perfect. I go through things, I think things, I say things that I know I'm not supposed to say or think, but I'm human. And I ask God to forgive me and I keep it moving because I'm not going to ban myself because I'm human and I make mistakes. So I'm saying this to say, when my daughter was going under, I kept calling her children father, and I kept saying, well, why is she's not out of surgery yet? Because I was here keeping the children. So he was like, no, not yet. And I was getting a little antsy, and it's not that I was questioning God. That's what I'm saying. What I'm saying, we are human, and even no matter how much you follow God, everybody said, well, you're supposed to have faith, and I know that. But in reality, my reality was, okay, why isn't my daughter out of surgery yet? So but the complex case may take up to 4 to 6 hours. So my daughter, they had started late with the surgery anyway, I found out, but she was in surgery for a good 5.5 hours. So I was getting antsy. So now you know the name of the surgery and this condition that she had. So after that, she finally got out of surgery the wee hours of the morning. And I just want to tell you what is endoscopic. I want to explain to you what is endoscopic, endonasal. What is the endoscopic endonasal approach? Okay, let me try to get this here on my computer. Okay. I'm going to explain to you first. Bear with me, guys. Okay, let's go back some. Okay. So they can perform this surgery through the ear, nose, and throat, right? Concepts of treatment reoccurring. Okay. So the reason why they give you surgery when this happens, because it can turn into meningitis. And we know meningitis is very dangerous. So let me go here and tell you, show you what I have here. Hold on one second. Just bear with me, guys. Well, anyway, my baby is doing great, and I'm glad to hear that and know that. Okay. The cerebral spinal fluid, that spinal that was leaking through her nose, the leaks are commonly diagnosed as migraines, other headache disorders, or sinusitis. And that's what I was saying. We kept thinking that's what it was. But as time progressed, and she kept saying, Mom, something is not right. Okay, let me see. Cerebral spinal fluid leaks may originate from the brain or spine, causing headaches, dizziness, and other symptoms. And that's what Takia was experiencing. Her eye was twitching. She was getting these severe migraine headaches, and it was getting to the point that it was getting bad. So I'm glad she went to the doctor when she did. And let me just tell you this right here. The CSF leak is repaired using your own tissue from the nose or with a biomaterial graft. Length of stay in the hospital depends on the size of the leak. Most patients are in the hospital for a few days after surgery. Some patients may require a lumbar drain that is removed before going home, and that's what my daughter experienced as well. The tear or the hole allows the CSF fluid to leak out. The loss of CSF causes the previously cushioned brain to sag inside the skull, which results in a headache. Loss of fluid also causes a lowering of pressure within the skull, a condition called intracranial hypotension. That's like almost having high blood pressure in your head, right? My baby went through it. Okay. Got that already. Okay, I said that part. I was just clicking on some things. Treatment for cerebrospinal fluid leak, which is the CSF for short. It is highly recommended because of the risk of meningitis. So my daughter went through a lot. And like last night I was downstairs with her and I just, wanted to be with her. I kept going down to check on her to make sure, she was okay, because I know it's a lot dealing with the kids, two little rambunctious girls. So I just wanted to be there with her. So as we were talking, she was like, "Ma, I just want to be in your arms and I just want you to hold me." And I said, "You know what?" She said, "Ma, you think I'm too big for you to just hold me?" I said, "No, I know you're not." I said, "But sometime a little," now I wouldn't say hard on her because I try to be there for her, but I know she's a mom now and I don't want her to feel like I'm babying her. But when she held me and I just hold her last night and she was like, "Mom, this just feels so good being in your arms." And it's like little things that we take for granted, like life is not promised to none of us. You never know what's brewing in the insides of your body. So I neglected my body, not overshadowing my daughter from her situation, what she's going through. But I neglected my body so long, working for so many years. I was at one job for 12 years. Then the previous job that I'm on, well, I was working on now, I've been out of work for 7 months. I neglected my body with no fault of my own, because I felt like I was a mom and then I became a single mom and I had to take care of my kids. So I was always going to school and working to better myself. But I neglected my body. So I understand where my daughter coming from, because once you become a parent, I don't know about you guys, but it's like you're so focused on the children, and being the parent that you are equipped to be, that you put yourself on the back burner. So now while I'm home, I've been running to doctors, the insurance company probably like, what in the world is going on with this chick? Every time I turn around, she's getting an MRI, X-ray, a CAT scan or something. And because I have so many ailments now, that being that God has set me down, I always say to walk for him now, I'm seeing the bigger picture now. Like I neglected my body for so long. So now I'm trying to get me right so I can live the rest of my time I have here. And don't put nobody before me, because it's about me. And that's how I want my daughter to be now. But I thank God that she didn't stop at the signs and the symptoms that she was getting, and she pushed on, because it's not that I didn't believe her, but I was wondering, Takia been complaining about her head for a while, and we got her the glasses, me and her dad, and I just didn't think it was that severe. But I'm glad she, as a woman, God allowed her to stay here, and her as a woman, she went and she got that situation handled. And now my baby is down for now because she has to recoup from the surgery. And a lot of things she used to can do on her own now, she's not doing. So after I finish this, I'm going to call down there and see how she's doing. And if she needs me, I'm going to be there for her. But it's just that when you have something going on with your body, don't take it for granted, because that's me now. I can barely walk the way I used to walk because I allowed this torn meniscus in my knee to set in with arthritis, and now it's osteoarthritis. So now it's bone against bone. So when I walk, it's like, when I put my feet down to walk, it's like I'm walking on a hardware concrete floor, because it's bone rubbing against bone. I have a little bit of cartilage left in my knee joints that give you the cushion to make your knee go backwards and forwards. But again, this is not on me. I'm just saying that, using me for an example, when you neglect the signs and when you know there's something going on with your body, when you know something is not right, go to the doctor and get it checked out. Because by the grace of God, my daughter, God was able to have people to save her. I prayed for the surgeons, the doctors, the anesthesiologists, the medical staff, the nurses, anybody that had their hands in dealing with my daughter operation and her recuperating. I pray, you know. So just don't take it lightly. Be there for yourself first. Because if you can't be good to yourself and help yourself out when you're going through things, how can you be good for your family and anybody else? So I just thank God that he spared my baby. I really do, because it was rough. It was rough, you know, and my daughter was in the hospital for a whole week, and now she's home, and she still, you know, she got to be assistance to get in the shower and walk and all that. And it's, you know, to see a young woman like that, 30 years old, it's not easy to look at as a mother, but I'm going to be there for her. And I have faith in God. He brought her through this far. He's not going to leave her now, you know. So I'm just telling you, thank you guys for the prayers and the love. Take care of yourself, because you never know what's brewing on the inside, okay? Don't take it lightly. I love you guys. May heaven smile down upon you. And me and Taki and the whole family, thank you guys for the love and the support. God bless you.